Representative Dingell for 5 minutes of questioning.
Thank you, Madam Chair. It's good to see you here, and thank you for coming in and testifying on this important topic. As you know, the coronavirus pandemic did upend our nation, and it strained our healthcare system, stunted our economy, disrupted children's learning, and no community was left untouched. It was the worst public health crisis we've experienced in a century, and you've come into the CDC at a time of turmoil, unrest, et cetera. And even as we continue emerging from the pandemic, COVID-19 is still with us. I say to everybody, we may be done with COVID-19, but it's not done with us, and we continue to see infections. It's fundamentally changed our nation, and we're still dealing with many of the consequences. Today, one of the problems we still have is we continue to witness significant distrust of our public health institutions, like the CDC, unfortunately. So, one of the questions I keep asking myself, how can we expect Americans to make the best decisions to protect themselves and their loved ones if they don't have confidence in our leading public health institutions? So I was going to ask some of the same questions my colleague just did on some of the communication issues. I know you're making this a priority, and I'm going to reinforce and maybe do a few more for the record, that it becomes really, really important, because one of the things that I'm very concerned about, we're hearing an uptake in respiratory cases. People aren't getting any of their vaccines. There's a distrust of all shots, of all, not only the COVID-19 vaccine, but the flu and the RSV. Why is it so important for people to get the latest COVID-19 vaccine and these other immunizations as well?
Well, thank you, Representative Dingell. You know, I've been traveling around the country sharing with folks about why to get the updated COVID vaccine. It's really three reasons. One, the virus has changed. So in the same way that the flu virus changes year over year, we've seen the COVID virus change. And you want to make sure that the protection you have is matched to the way the virus has changed. Second, whether you've had COVID before or you've been vaccinated before, that protection decreases over time. And you want to make sure you are boosted up to the highest level of protection you can going into a time when we know we will see more COVID circulating. And third is about reducing the risk of long COVID. We are still seeing 1 in 7 adults have extended symptoms, even from a mild case of COVID. No one wants to be sick for a short time, certainly not for a long time. And so for those reasons, we are encouraging folks to get the updated vaccine. It is why, when we look at the data, there is not an age group that doesn't have some increased risk from the COVID virus. Certainly, our seniors are at the highest risk. So those who are over 65 are at the highest risk of hospitalization and death. But our vaccines can prevent them. And I know we've been focused a lot on vaccines, but I just want to mention treatment again. We do have treatment for COVID and for flu, but you have to know you have it, which means you need to get tested. We are offering free COVID tests at covidtest.gov. We want folks to make sure they're ordering those tests so that they can get treatment.
So let me ask you a quick question. On top, there's a lot of misinformation out there, and a lot of people are still afraid to get all of these different immunizations. Getting back to the communication issue, how are you combating misinformation?
Yeah, so in order to combat misinformation, one, you just have to get a lot of the good information out there, and that means we have to partner with folks who are trusted. So whether that's doctors and nurses, and that's where we've been focusing a lot of our efforts, is to make sure our doctors and nurses and other healthcare professionals have what they need, but also whether it's the faith community or others to help get good information out, and I include Congress in that as well, to help us get good information out to communities to make sure that they hear the good information, the accurate information, so they can make choices for themselves.
So you're almost out of time. I may do some questions for the records, but since we only have less than a minute, is there anything else you want to add about the work you're doing?
Just that I think the CDC is on the right path, but we have more work to do. And I recognize that we do need help from Congress to make sure that we are well-resourced and have the authorities related to data and workforce. We talked earlier about the importance of making sure that we have a vaccines for adults program as well. We have a vaccines for children's program, but do not have something similar for under or uninsured adults. So all of those things I look forward to working with Congress on.
Thank you.
Thank you.
I yield back, Madam Chair.